So at the very recent meeting of the Council of Presidents of the Medical Colleges, or CPMC, there was much more positive interaction with various government bodies, including the medical board. So I think gradually we're getting there, improving the relationship with government as they recognise that we are very much prepared to be partners with government organisations, but also we're prepared to change. We would look increasingly at flexibility, but also definite lines in the sand with how we work with various regulators. One of the things that has become very clear is the importance of CPMC to be a single point of contact between government and the colleges. And so trying to rebuild that reputation standing has been really important. Something else we've found working with the other colleges is that we're noticing increasingly that if we identify that a particular hospital has problems, other colleges may have as well, and this may lead to combined action to try and improve the situation at those hospitals. There's a very interesting recent document from a group called the Commonwealth Fund in the United States, and you'll see a link in the written part of this report. And the Commonwealth Fund compared a number of high-income countries, including Australia and New Zealand, and found that overall both countries do very well, recognising there are those in our countries who don't do so well, particularly our First Nations people. Of particular interest is how much better we do than the United States. While there are a number of reasons for why overall patients have good outcomes in Australia and New Zealand, one reason is that we really champion medically led multidisciplinary care with patients, which increasingly has shared decision making that is patient-centric. And if we look at the perioperative medicine program within ANZCA that we are leading with other colleges, that is very much the focus of that program. There is no doubt that one of the reasons Australia and New Zealand do well is high quality community practice led by general practitioners. So we actually have three colleges. We have the College of GPs in Australia, the College of GPs in New Zealand, and the College of Remote and Rural Medicine, all contributing to high quality community care. And this is something that makes our two countries exceptional. When one looks at the Commonwealth Fund report, the major deficit Australia has in particular is access to care. And it is very clear that one of the major reasons for this is lack of doctors in regional and rural Australia. And so there's a lot of emphasis from government, but also the college recognises that to fulfil our purpose to support and care for our communities, that we do need to enhance the rural and regional workforce. One of the things that is clear is that there are now clearly identified characteristics of those more likely to work in the country. And unsurprisingly, it's those who grew up in the country, those who went to medical school in the country, and also those who did junior doctor years. Now, there's expectation that the college will work to implement and weight these factors in selection for training, as have a number of the other colleges, particularly the College of Surgeons.